Do you feel tired all the time? Do you experience dry nails and rough skin even if the winters are far ahead? To explore the reason of these signs, stick to this video and don't forget to hit the like button. Bone health and strength depend on the body's ability to absorb calcium, and vitamin D ensures that this process runs smoothly so that calcium may be absorbed in the digestive tract. The absence of symptoms in adults is not uncommon until the shortage becomes severe. Before I further dive into today's video, make sure you are subscribed to my channel to stay tuned with the beneficial and helpful videos that I come up with almost daily. Let's begin. Possible causes of inadequate vitamin D include, but are not limited to, failing to expose skin to appropriate amounts of sunlight. If this is the case, you may suffer some of the signs of vitamin D deficiency. Some of the symptoms you may be experiencing due to a vitamin D shortage include: Number 1, weak bones. Calcium is absorbed by the body with the assistance of vitamin D, and a deficiency in calcium can lead to decreased bone density. Fractures are one of the potential outcomes of osteoporosis, a condition in which bones become increasingly fragile and lose some of their density. In most cases, people who have muscle or joint pain believe their calcium levels to be low and take supplements as a result. But the true problem is a lack of vitamin D in their bodies. It causes the muscle and bone pain. According to the Bone Health and Osteoporosis Organization, vitamin D plays a very important function for women going through menopause, a time in their lives when their bone density begins to diminish and their chance of developing osteoporosis increases. The relationship between vitamin D and strong bones and muscles is one of the topics that has received the greatest attention from researchers. It has been shown that elderly persons who do not get enough vitamin D have an increased risk of breaking bones. Vitamin D makes it possible for your body to take up calcium and phosphorus, both of which are essential to the process of constructing robust bones. High intakes of vitamin D doses, 800 IU per day, could decrease the chance of fractures by 20%. Those with adequate vitamin D levels had increased levels of muscle strength, which was beneficial in preventing fractures and injuries. Number 2, depression. Depression is the primary symptom of seasonal affective disorder. This mood disorder typically manifests itself in the wintertime. This is because your body is not getting as much sunshine as it used to. Serotonin, a neurotransmitter that helps maintain our sense of well-being and happiness, can get depleted when we do not get enough sunshine. According to a number of studies, serotonin levels tend to increase when people are exposed to intense light, but tend to decrease when they have less exposure to light. But the decline in mood isn't just related to the drop in serotonin. It could also be attributable to the vitamin D deficiency in your body during the wintertime. Number 3, hair loss. It has been suggested that a lack of vitamin D may contribute to hair thinning and other hair issues. Since vitamin D encourages the growth of hair follicles, deficiencies in this vitamin might have a negative impact on the appearance of one's hair. Patchy hair loss caused by the autoimmune disorder alopecia areata may be associated with a vitamin D deficiency. According to the findings of several studies, those who have alopecia areata have significantly lower levels of vitamin D compared to those who do not have alopecia. People who do not have alopecia are nonetheless at risk for losing their hair if they do not get enough vitamin D. Women who experience various types of hair loss also have lower amounts of vitamin D in their bodies. The production of new hair follicles is assisted by vitamin D to some degree. The little pores from which new hairs emerge are known as hair follicles. Growing new hair follicles can help hair keep its fullness and avoid thinning. As a result of this connection, consuming the recommended daily quantity of vitamin D can help encourage the development and regeneration of hair. Number 4, fatigue and tiredness. Lack of vitamin D is one of the potential reasons of fatigue, which can be caused by a wide variety of other factors as well. Regrettably, it is frequently disregarded as a feasible explanation for the problem. Extremely low blood counts can produce weariness, which has been demonstrated to have a significant and detrimental impact on one's life quality. It was discovered that a lady who frequently complained of daytime exhaustion as well as headaches had a blood level of vitamin D that was just 5.9 nanograms per milliliter. This is regarded poor, given that anything below 20 nanograms per milliliter is deemed to be insufficient. The woman's symptoms disappeared once she began taking a vitamin D pill, which caused her blood level to raise to 39 nanograms per milliliter. On the other hand, even if your plasma concentrations aren't dangerously low, they could still have a detrimental effect on your activity levels. Number 5. Acne/eczema. Inadequate levels of vitamin D can contribute to a number of skin conditions, including acne and eczema, as well as other problems. A shortage in vitamin D, which is a hormone in its own right, may almost certainly have an effect on the other hormones that your body produces. As a result, an imbalance in hormone levels is conceivable. In addition, having enough amounts of vitamin D stimulates your T cells to help fight illness, which includes the germs that cause acne. It has also been shown that vitamin D can reduce inflammation and keep your insulin production under control. Acne and eczema are two examples of severe skin disorders that can be helped by this remedy. Atopic dermatitis, more commonly known as eczema, was reported to show clinical benefit in individuals who took oral vitamin D supplements. Additionally, vitamin D may have an effect on sebocytes, which are cells in your system that are responsible for the excretion of oil by inducing the formation of proteins that have bactericidal effects. Number 6. Joint pain. Vitamin D is essential for healthy bones and muscles, and there is some evidence that it can also reduce inflammation. As a consequence of this, a lot of individuals think that vitamin D is helpful in alleviating joint pain, particularly in cases where inflammation is the root of the problem. Many studies have found a correlation between vitamin D deficiency and rheumatoid arthritis, RA, which is a persistent inflammatory illness that impacts the joints. Vitamin D supplements are beneficial in the treatment of osteoporosis and should be taken regularly. Patients who suffer from RA are at a greater risk. Supplementation is recommended because it reduces the risk of bone fractures and joint discomfort, both of which are increased with osteoporosis. Number 7. Brittle nails. Nails that flake off easily may indicate a vitamin D deficiency. Keratin is the primary structural component of both the hair and the nails. When there is a deficiency of vitamin D in the body, the concentrations of phosphorus and calcium in your body are also not adequately balanced. Vitamin D facilitates calcium absorption in the intestinal tract. If vitamin D is not present, calcium will be flushed out of the body through the urine rather than being digested by the body. If you don't get enough vitamin D, you'll notice that your fingernails and toenails start to peel. If you recognize that the same thing is occurring to your fingernails as it is to your toenails, then this is an indication that you are lacking. On the contrary, if the nails are peeling as a result of external causes, such as trauma or overuse of the nails, then it is highly unlikely that nails would exhibit the same symptoms. Number 8. Impaired wound healing. If you have just undergone surgery or been injured, and your wounds are taking a long time to heal, this might be an indication that your vitamin D levels are also too low. Vitamin D appears to stimulate an increase in the creation of substances that are essential to the process of generating new skin tissue as part of the wound healing procedure, whereas a lack of vitamin D can slow down the healing process in specific ways. It has also been proposed that the anti-inflammatory and antimicrobial properties of vitamin D are crucial for optimal healing. Vitamin D has been more likely to have greater levels of inflammatory markers, which can be detrimental to the healing process. Number 9. Poor skin health. Vitamin D is essential for preserving the health of skin cells, minimizing the appearance of fine lines and wrinkles, enhancing the suppleness of the skin, and ensuring a clear, radiant complexion. On the other hand, prolonged exposure to the sun's ultraviolet radiation can be detrimental to the health of the cells that make up your skin. In point of fact, they may pose a threat to your overall health. It is essential to use caution in order to locate the optimal equilibrium, and more will be said about this topic in the following section. During the process of skin cell regeneration, calcitriol, which is the active type of vitamin D, plays a crucial role in the development, repair, and breakdown of skin cells. Keratinocytes, which make up 95% of all the skin layers in the epidermis. This is necessary since your skin cells are always dying. This action contributes to the formation of the framework of your skin, which is responsible for retaining moisture and ensuring that your skin remains hydrated. Vitamin D is essential for keeping this cycle working properly in order to ensure that your cells continue to regenerate and that your skin continues to be youthful and beautiful. Bottom line, vitamin D insufficiency is quite widespread, although the majority of individuals are unaware that they have the condition. The good news is that vitamin D insufficiency is often not difficult to treat. Either spend more time in the sun or consume more foods high in vitamin D, such as fatty fish or milk products that have been fortified with vitamin D. Another option is to take a vitamin D supplement to overcome their deficiency. That's all for today. I hope you find it helpful. See you in the next one.